Thank you, Maria Rosa. Next, we're going to hear from JHPIEGO, from Richard Lamporte and Stuart Merkel, talking about partnerships and impactful program approaches from an NGO perspective.
So thank you, Bruce, and thank you, Rachel, for your help in organizing this in Renuka as well. It's been very stimulating today, and time very well spent. We'll sort of tag team right up here, so we won't be walking back and forth to our seats in order not to waste too much time. But why don't we start off a little bit differently, because we're last, and one of the last but not the least, and invite somebody else to start things off here. So let's see. Everybody else has been able to work it.
Jerry Lewis. Jerry Lewis. Jazz. Jazzy. JHPIEGO. Maybe there's more emphasis on the H. JHPIEGO. JHPIEGO. Jam. Do you know how to say it? No.
So we, in part, wanted to show that because it's part of a new creative partnership there that we have with, Comedy Central and Funny or Die, which was in part created by Will Ferrell. But also that we're serious about the work that we do, and when I say we, it's everybody in this room. But we're not so serious about our name, and we all have to find creative ways to get over certain challenges. Part of that video was about trying to get over the challenge of having a fundraiser's nightmare of a name. In any case, the purpose of this effort right now is to really talk about some of the experiences in formulating and actually trying to bring together public-private partnerships. And so we'll touch on a little bit of what's under the hood, some of the language that we use within an international NGO, and in the spirit of really trying to find that common ground of really being able to communicate effectively between each other. What are some of the relevant trends, and what are some of the takeaways from our experience? So context matters, but also what matters is who you are, and where JHPIEGO comes from. We wouldn't be an organization that worked in over 30 countries and has over 3,000 employees, and at this point over 30 different partnerships if we actually thought and acted on our own. We pursue our mission of preventing the needless death of women and newborns principally by 4 interconnected ways. One is that interaction between a provider and a client and the quality of that interaction. Another is the systems that support that interaction, so that they have the right tools, so they can do the right interventions in the right way at the right time within a good quality improvement framework. Another is building bridges with community, and often doing that with and through other partners like Save the Children, who's here present. And the other is the enabling environment, so that the latest and greatest evidence can be translated into practice through new standards, guidelines, and training systems. So within that context, in 23 years of work in this field, I've never seen a period of time where so many different sectors felt like they're on the same team. But again, one of the challenges is how do you communicate across that? And as Peter Singer challenged us to do, to really be focused on the push side of the equation, to engage with the end in mind, so that whatever you are doing has financial, social, and efficacy, sustainability. So why is it relevant for us to contribute a bit here? In part, it's because in the period of expansion of our partnerships, which is really in about the last 10 to 12 years, we've had the privilege to, I think, engage in all of the 4 areas that Gary had mentioned earlier, the categories. And what Gary was saying was, there's corporate philanthropy. And for us, we would counter that, and it was more along the lines of visibility and interest as a driver to be seen as a quality a group that is doing good work in a particular country. Overall CSR, which fits into a somewhat of a similar category, and where it's more of a transactional kind of situation where we would receive funds to do something that we felt was important to the countries where we're working in, but very little interaction, of course, with what in this case really would be a funder or a sponsor. Talked about advocacy and policy development as another category. In certain ways, and shared value, in certain ways, we experience that as a driver of either market development or market shaping. And how do we, and the comfort level that we may have in the situation where, okay, is our potential partner promoting a particular product, or are they promoting a particular concept and the importance of a particular approach to achieving improved family planning or maternal and neonatal health. So in that arrangement, we're learning an awful lot, and what we'd like to do is talk a bit about our internal drivers and how we experience some of these partnerships through 2 stories.
Great. So thanks, Rich. The question on how we approach partnerships, I think we've talked, some of the speakers today have really ably described what are the things that they think about when partnership, and I think the important piece to share here from JHPIEGO's perspective is it's the same thing. At the end of the day, it comes down to alignment of interest and being able to be honest about that alignment. What's in it for us and what's in it for them? And how does that align with the global need? And how is that going to meet some particular stakeholder's interest and avoid some conflict of interest on the other side? And the second piece is trust. That's the other part that is so important. It's been mentioned several times today. And that trust takes time. It takes work. We take partnership very seriously at JHPIEGO. It's not something that you just jump into a partnership. You jump in and you do something small, you do it right, you do it well, and you build from there. And I think the example that I wanted to highlight before we move to some of the nuts and bolts of what are the drivers of alignment is actually JHPIEGO's partnership with GE, General Electric Foundation. We've been working with GE since 2008. Our first country where we got things going was in Uganda, and that was a country of interest for GE from a business perspective, from their foundation's perspective. It aligned with where they wanted to invest at that time. And we had major interest in supporting the Ministry of Health. Our primary client in most of our work is the ministry. In any event, that partnership expanded to work in Indonesia, where we were looking at a new sort of semi-risky system on educating moms about healthy pregnancy through an ICT for D, ICT for Development approach with SMS. They expanded to Myanmar after the Minister of Health of Myanmar visited JHPIEGO in Baltimore, and GE had strong business interest in Myanmar. We formed a partnership to respond to a request from the Ministry of Health to look at capacity building in the largest women's hospital there. Again, building on the experience from what we had done together in Uganda. Looking at new product innovation. We have a pipeline of new products that we're trying to bring to market, and GE helped us seed invest some of the process and thinking and institutionalization around how you do product innovation development at an organization like JHPIEGO. And then lastly, in the past year or so, we began this discussion about where do we go from here? We've got this project here, and we've got this project here, and this other project here. How do these things fit together? And we talked about strategic partnership. Again, thinking about alignment and listening. right? Trust. And we had a very open discussion about where do we want to go from here. And a great colleague and friend, David Barish, and Asha Varghese from GE Foundation came to Baltimore, and we had this really great dialogue and ended up realizing that there are lots of things we want to do together. So as they went into their strategic planning process on where their foundation wants to go next, we also did some similar thinking and ultimately came up that we want to work together on safe surgery. Surgery is a huge need globally. We could spend a long time talking about surgery, but we are now in the process of piloting our very first program in Ethiopia, again, under the leadership of the Ministry of Health, to look at the various factors that influence success in a surgical ecosystem at the district level. We're focusing on leadership development and capacity building as a driver for change in that program. There are other great partners on the program as well. And the really exciting thing about how this is working and why it's working and how we know it's working is that it's attracting additional partnerships, right? Alignment, good alignment attracts more people into the mix in our experience, and that's what's really exciting. So what are the drivers? We've talked about this all day long, so I didn't want to spend too much time on these things. The one thing that perhaps we didn't talk as much about, it was mentioned by a colleague from Merck, is compliance. A lot of what I think companies and NGOs and US government and all of the partners that are working in this space are trying to do is to do the right thing and do it responsibly and remain in compliance. It's something that we keep in the very forefront of how we do our business. It's not as perhaps sexy or as exciting as the indication of where we're going with the health outcome, but it's just as important to make sure we're good, responsible stewards.
So we've talked a lot today about risk and what are some of those risks associated with partnership. And so we're going to take a little risk here and talk about where there's some misalignment and what we can take away from that. So this is supposed to represent taking 2 steps forwards, but perhaps a step back. And this is a story. Names can remain anonymous, but it really relates to almost an ideal situation. Under our current context, you had a large bilateral donor who was interested to help seed the investment of 2 larger, well-resourced foundations in a particular country, that with also some of the technical assistance of a large, well-resourced international foundation, wanted to focus on really making a difference and making a name for themselves in the health sector. And came together, studied the situation for about 2 years. Were involved in consultation related to that. Really, worked with a firm to help them establish, how should they conduct the selection, and then the terms and metrics related to this particular project, which would be one of the first of its kind. And we participated in, along with about 3 or 4 other groups, in a set of oral engagements about, okay, so what would be what would be the best situation and what best group to work with in order to realize this vision. And it's interesting because what's different about this is you had players engaged who really come from the developing world, who have resources generated domestically and have an agenda that they're driving domestically. And this is in part sort of a bit of the brave new world of some of the public-private partnerships that we hope to see, and I think we're going to be more common into the future. But in going through this process, one of the things that, as an INGO, we look at are some of the factors, that are driving private sector and the factors that are driving ourselves, and some of those areas where you can get some misalignment. And one, when anybody's going into a brand new venture, you want to try to not slip up. the price of failure seems higher, especially if there's a lot of eyes on that. And one of the ways to mitigate that is to put more controls around it. In this case, it was an approach that was very much about treating the counterpart, partner, whatever agency engaged, really as a vendor that would carry out very specific activities that were already predefined in a predefined timeline with a predefined cost and with predefined metrics, which makes great sense in many ways if you really have a deep understanding across all the domains required for the project, which they may or may not, but that was one we felt like we could still navigate, but we knew where things were coming from. Where we ran into some significant challenges were we had fantastic alignment in terms of where this investment wanted to operate, in which geographic areas, in which content areas, and also having very deep and current investments in conjunction with government and in conjunction with even some other supporters. So the leverage on this was really substantial. But we ran into the rub in relation to the actual interventions that they wanted to carry out, which in many ways are really comprehensive, including data for decision making in real time, were directly aligned with some existing initiatives and existing initiatives that were actually already branded by government. And in the excitement to align everything here, the barrier really was, well, this new investment really wanted to be branded in a particular way and really couldn't even entertain having a co-branding kind of initiative. So we had to decide, is our relationship and our reputation thinking long-term with our counterparts in government sufficient, more important than actually this very, very exciting project? And the takeaway was no, and in this case, the money and the opportunity was insufficient. And the takeaway was what we really felt needs to happen in these kinds of situations is ourselves as an INGO and in the formation of these new partnerships is to be open to learning in that process and course correction. So let me pass it over to Stu and we can finish it off.
Yeah. So some last thoughts on what is good partnership. I spend a lot of time thinking about this, and at the end of the day, what I've come to. This is my thinking that having a good partner is like having a great spouse, right? So spouses are kind and they are considerate, ideally, right? I've been married for 10 years, so anyway, so they're kind, they're considerate, and they're firm, and they understand that you have the best of intentions, and when you miss the mark, they say, and they help you figure it out, and certainly, our partners are very gracious about helping us figure it out when we miss the mark. But they're also, the kind of thing that they're forgiving and willing to learn with you. So anyway, that's my analogy on practicing good partnership, and we aim for that in all of our partnerships. The metrics of success that we look for with a partnership is how mature is that partnership? How likely are we to be able to pick up the phone, be honest, be upfront, work through problems together, learn together?